Aloha everyone and welcome to the Hawaii Pacific Gerontological Society's April webinar. My name is Mapuana Ta'amu and I am one of the board of directors for HPGS and chairperson for these webinars. I wanted to start by introducing the chat box available to us all. If you toggle around your screen, you'll see an icon of a chat bubble with the word chat under it. You can click that button and you will enter the chat room where you are able to submit questions or comments throughout this presentation. Questions will be gathered throughout the presentation and answered at the end, so please feel free to send in your thoughts, questions, and concerns regarding the various levels of care for geriatric patients. If you have trouble with the chat box, you may also text us at 808-469-5330 with your questions. If you aren't already, please consider becoming a member of HPGS so that you can stay updated and invited. There are various rates for individuals, organizations, and associates. Here are a few benefits you'll receive with membership. Monthly newsletters where members are welcome to submit articles to be published. We offer free monthly webinars and members are eligible to be a speaker. Special invitations to general membership meetings, kupuna-related events and workshops, and also scholarships to help anyone of any age pursuing education in the field of gerontology. For more information, visit us at www.hpgs.org. To become a member, head over to hpgs.org and in the top navigation pane, click on the membership tab. Here you'll find more information about our membership benefits. Scroll down and click the HPGS membership form link at the bottom, fill out your information and click submit. Following this webinar, it will be uploaded and archived to our website at hpgs.org. From the homepage, hit the webinar tab and you'll be redirected to our currently offered upcoming and past webinars. This webinar will be added to our website no later than 1 week after today. Please feel free to share this webinar with your friends or family. All right, let's get down to business. We have gathered here today to talk about levels of care in our local community. Thank you to those of you who have submitted personal questions that you have about the various levels of care. We will get to those towards the end of this webinar. If you have any other questions, please do use the chat box to type in your question or send a text message to 808-469-5330. Now, I'm sure many of you are either aging in place at home, considering transitioning to a care facility for yourself or a loved one. You might be a caregiver or maybe a student interested in learning more about what Hawaii's healthcare system has to offer. Today, I've invited a special guest with expertise in the field to educate us about the different levels of care for a geriatric population. Our speaker today is the lovely Eileen Phillips. Eileen Phillips is a registered nurse having over 25 years of experience in nursing after receiving her Bachelor of Science degree in nursing from the University of Hawaii at Manoa and a Bachelor of Science degree in marketing from Florida State University. While in various management roles at the Queens Medical Center, she specialized in postpartum, special care nursery, and pediatric advanced life support, and enjoyed teaching families on postpartum care. She is currently the Client Service Director for Attention Plus Care with a focus on the medically fragile population. She also advocates for families and individuals needing home health care. Eileen extends her clinical practice by volunteering in the community to present outreach for seniors on various topics on aging. Eileen Phillips is also the president-elect of our Hawaii Pacific Gerontological Society. Eileen, thank you for being here today.
Thank you, Mapu. This is a very interesting way to present information to the community, and I really wanted to thank you for making these things happen because I think it's going to help the community a lot. So today I'm going to be talking about levels of care in our community. This is a really broad topic, and as I started to prepare this presentation, I myself learned a lot about what our community has. And I'm going to share some of what I've learned today, and I'm also going to challenge you to think a little bit more about what your needs are or what the needs of your loved one are. So the first question that we asked ourselves in this topic is, what does aging look like? Well, the answer that I came up with is it depends. What's going on in your life? Is there something that might be causing you to have a chronic disease? A chronic disease are things like diabetes, COPD, kidney disease, Parkinson's, Alzheimer's. Those are all considered chronic diseases. So your aging is going to look different depending on what you've got going on medically. The other thing that affects your aging is what's your lifestyle like? What are your habits? Have you been a smoker for 40 years? Have you been drinking all of these years? Have you not been drinking? These actually are things that do affect your aging. Exercise, have you maintained your exercise throughout all the years that you've been living? This is a really good way to maintain your health and to keep the aging process a little bit less dramatic. Believe it or not, 25% of your aging comes from your genetics. So when you look at people who don't age, that they look the same than they did 40 years ago, maybe not that much, but 10, 20 years ago, they don't look their age. It could be that that's part of their genetic makeup. So one of the things that I've learned in working with the elderly is there was a study done, and some of you are aware of this, where they looked at populations around the world that had the most centenarians. So we learned from that study that people from Okinawa tend to live longer, and they're one of the populations that have the most centenarians. So we think that that's possibly connected to their genetic makeup. It also has something to do with their lifestyle and the food they eat, that kind of thing. But there might be a gene that actually works to their advantage to keep them aging gracefully. The other thing that affects your aging is the environment. So the environment could be, maybe you live in a place where there's a lot of sun, like Hawaii, right? So they've done studies on twins where you look at a twin at age 65 and their other twin who maybe lived in a completely different environment, and that the twins, even though they're identical at that age, they look completely different. You can look this up. It's very interesting. You can look at twins aging and environment, and you'll be able to get pictures of actual comparisons of the same genetic makeup, but the environment was different. So they've aged differently and they look completely different. The other thing that affects your aging is your family history. Chances are if your mom lived to be 102, chances are you're going to live to be pretty old as well. I've had two grandmothers, and both of them lived to be 97 and 96. I hope that I can make it that long. But as far as my family history goes, it looks like I have the potential to do that. So these are all different factors, and I'm sure there's many more. But since I'm a nurse, one of the things that I have to look at is medically, what does aging look like? So this was an interesting quote that I found online. You only live once, ? It's false. You actually live every day. You only die once. Is that true? That's true. So aging looks like what you choose to make it look like. You have a choice in your life to age gracefully or not. So as a nurse, I want to look at the noticeable changes that happen to your body, your brain, all of these systems. So I'm going to go through each system and kind of give you an idea what aging looks like from a physical standpoint. So we all know that as we age, changes happen in your brain. Maybe you have a need to work on your thinking skills, or your memory starts to go. Dementia is not a normal aspect of aging. It just might be that you're forgetting things a little bit more, and that's normal for brain changes. Nervous system, maybe you've got spinal stenosis. This is a condition that kind of closes down the spinal column, and it affects your nervous system, and it might have changed the way that you move. Maybe your walking looks a little different. Eyes, we all know that as we get older, our eyes change. Things become harder to read. We need reading glasses, and then we don't need reading glasses. So it's really quite frustrating, actually. So that's normal. That's normal aging of the eyes. Also, things become it's more glary at night. So your eyes might be having trouble adapting to different light changes. Hearing is also a problem that does change. It usually diminishes as we get older, our ability to hear. Maybe high frequencies go away. The other thing that we tend to notice is that if you're in a crowded room with a lot of people, maybe you can't hear a conversation quite well, maybe as well as you did when you were younger. So teeth, I put this in because we don't necessarily think about our teeth aging, but it's the gums that are around the teeth that tend to recede. And this is why as we age, it's even more important to get to the dentist and have your dental hygiene evaluated. If your gums recede, then what's happening is you're getting more pocket area into between the teeth and the gums, and that's where food can accumulate. I actually went to the dentist a couple weeks ago, and he's the kind of dentist that talks to you a lot. So he was telling me about a 98-year-old lady that he had seen recently, and she had all of her life she had kept her teeth, and she did a really great job of keeping her teeth healthy. And the past year, for whatever reason, she wasn't brushing her teeth. She came into that next appointment at 98 and she had 10 cavities. So it's important to maintain oral hygiene all the way through your life. He, of course, had to do whatever he could to help with that. At a 98-year-old, there's not a lot you want to do, but he did it. He was able to help her. So keep brushing your teeth. Digestive system. So usually the structural parts of your digestive system do change as you age. Things start to slow down. Constipation becomes a big issue. This is well known in older adults. Urinary systems, there are changes that happen here too. The bladder becomes less, the muscles don't work as well. This causes you to retain urine sometimes, and that creates more risk for urinary tract infections. And working in this population, I can say that a lot of our elderly clients tend to get urinary tract infections quite frequently. So part of that is because of the aging of the urinary system. Muscles also change. So usually there's a loss of strength, endurance, and flexibility. But you can always work on strengthening your muscles at any age. So just because the muscles aren't working well doesn't mean you can't build more muscle. This also, if you don't use your muscles, you're going to lose coordination, stability, and balance. So keep moving. Skin, obviously, there's changes in your skin as you get older. It becomes less elastic. There's more fragile. You tend to bruise easily. Your skin is drier. Usually we drink less water, so that also doesn't help with our skin staying moist. Wrinkles, age spots, that's all part of the package. The other thing that happens in your respiratory system, this is your breathing. We tend to have a lower immune system, so all of these things are kind of connected. But respiratory infections become more common, and we tend to have a harder time as we get older getting over respiratory infections. And sometimes that will cause scarring in the lungs, which just adds to the problem of breathing. So that could lead to some chronic lung conditions. One is called COPD, emphysema. If you've smoked, you probably will have some of those problems in your lungs. Immune system, I mentioned, it's also decreases as we get older. Our elderly population may have had a different immunization program when they were younger than we do now. So their immune system is going to be more susceptible. They will be exposed to grandchildren, great-grandchildren. This is going to cause you to have more illnesses in your older loved one because they don't have the immune system that protects them from those kinds of viruses. Cardiovascular system, well, we all know the blood vessels change as we get older due to cholesterol intake. They get stiffer. Blood flow becomes harder for the heart to pump through those vessels. That could increase your blood pressure. All kinds of things can happen there, but that is just part of the aging process in the cardiovascular system. Skeletal system changes as well. The bones actually shrink and become more brittle. So also those that have osteoporosis, this is also a big factor. You may even notice that you've shrunk a little bit. Everybody I talk to that gets older says, oh, I'm an inch shorter now than I was when I was younger. And that's very common. So that's the changes in the skeletal system. And then the last thing that changes is our ability to maintain our weight, simply because our metabolism has changed and it slows down and we start to need less intake, possibly, depending on your activity. But if we continue to eat like we were when we were 25, you're going to gain some weight. So not a good idea. So my definition of age is it's just another word for living, and there is nothing you can do about it. So you can certainly age healthy, but there are so many factors that you're fighting in all of those systems and in all of those things that could happen. So do not fear, it's normal to age. So the next question I want to address, and this was also a real broad question, was what does it look like in the community when we start looking at facilities, where to put your loved one? If your loved one is needing to have more care and you're looking at where do I find this care? There's so many options. So I have some pictures on this slide that kind of give you some ideas on what is out there. We have a skilled nursing facility. There are care homes that you can look at. There's assisted living facilities. There are adult daycares. And then there's also care in the home. So these are all choices that you have to make depending on what the level of care of your loved one is. So, and that takes some questioning. So you need to look at the levels of care of your loved one and determine what is the best direction to go in. And it may change from time to time. So let's look at adult daycares or an adult day health care centers. So those are two different things, but just in general, having somebody go to an adult daycare center is one way to get them out of the house if that's what they need. Let's say that they're feeling isolated, that you're feeling like they can't be left alone because you have to go to work. They're calling you all the time saying, hey, when are you coming home? And you've only been at work an hour. So these kinds of situations, maybe an adult daycare would be a good option because it encourages socialization. It's a safe environment. There's somebody watching. There are other people who know what to do if something were to go wrong with your loved one. It keeps them busy. There's usually some sort of activity like a craft activity or exercises. Meals are sometimes given at these adult daycares. It gives your loved one the ability to live with you, but yet not be there 24/7. So that you can actually, if you want to go to work or you want to have your own time away, and you don't have to commit to 5 days a week daycare. There are daycares that can have different programs that can take you 2 days a week or 3 days a week. It really depends on what your loved one is looking. If they look forward to it and want to go every day and you can afford it, go for it. Sometimes the requirements are different depending on the daycare, but in general, usually they need to be 55 or older. They need to be able to walk. They should be continent, which means they can use the bathroom normally. They shouldn't be a wanderer because normally daycare centers are not lockdown units. So they need to be able to have enough cognition to be in an environment with other people and not try to leave. They need to be able to eat their food independently. Usually minimal assistance is needed to transfer them from a chair to a wheelchair or chair to a toilet. And they shouldn't be combative either. That would scare the others in the daycare. So let's just talk a little bit about what the difference between an adult daycare and adult day health is. So the word health is an indicator that there is more going on there at that daycare than just supervision. There may be, it may be a facility that has nurses that are available to help people who need more care during that daycare period. Maybe they need to have their medications passed. Adult daycares don't normally have that option. So adult day health care centers are licensed by the state, as are adult day care centers. It's kind of hard to talk about both of these at the same time. But you can also look for specific adult day care and adult day health centers that work with those that have Alzheimer's or some form of dementia when that's needed. These are usually not covered by Medicare. However, if your family member qualifies for a Medicaid covered daycare, there is some financial help that you can get through that. So it all depends, again, if there's a Medicaid qualification. And Medicaid is certain assets have to be below a certain number in order to qualify for Medicaid. So it could be out of pocket expenses, or there could be some supplements. So the next thing that you might want to look at if your family member is ready is a care home. I did some research on this, and there's quite a few care homes in the state of Hawaii. But the one thing that if you're going to look at a care home, you want to look at a care home that's licensed by the state. That should be ready and available for you to check if you call them. There's also a list online that I can show you, I believe in the next slide, that will show you where the list of licensed care homes are in the state. So the advantages of a care home are that they're smaller than big facilities. They have less residents normally, although there are larger care homes in the community. And that makes it more intimate. If it's a smaller, it's like a home. The staff is usually available around the clock. There's usually somebody there because you're living in a home, so they have to have some sort of staff available for overnight emergencies. Usually the licensure, because they're licensed, they have to have certain standards in place in the home in order to get their license. So that is a safety net for those that are worried about things that may not be safe in a care home. Some of the care homes for you may or may not be affordable. They range widely in price. So when you call and ask about costs, there's a lot of factors depending on, and like every situation is different. So you may have enough money to afford a care home that costs $10,000 a month. You may not have that much to afford that. So you may have to go with a smaller, more cheaper licensed care home. So there's a wide range of options. The best thing to do is to look at the list, decide where you want the care home to be on the island, and then also look at price, and then also look at, make sure they're licensed. And the list kind of goes down a couple of things that are needed, like whether it's a female bed, a male bed. All of this list that I'm going to show you has available vacancies of care homes. It also has care homes that don't have any vacancies. So you have to kind of look at what you can afford. Some of the care homes also specialize in Alzheimer's and memory care needs. So if you have a family member that is needing that and you're considering a care home, you're going to want to look for those first and see if there are beds available. Because of the Alzheimer's increase in our communities, those beds are probably going to be tough to get. So you might want to start looking ahead of time just to prepare yourself so that you know what is available in the community. Usually in care homes, they get meals. So 3 meals a day, snacks, medications can be given in licensed care homes. And they usually require, if the person who's in the care home is what we call an expanded resident, expanded care means that they are total care. So they need somebody by their bed at the whole time that they're there. They can't get out of bed, they can't walk, all of their care needs to be done. Licensed care homes are allowed to have these people in their care home, but can only usually have a limited number in the home, simply because the staff can't handle somebody. If there were 5 people that needed that kind of care, there wouldn't be any way the care home could handle it. So they usually only require or allow 1 bed to be an expanded care bed. So you want to look at that if you are looking at care homes. How many expanded care residents are they allowed to have in that care home? They usually, if you're not an expanded care person that needs care in a care home, they usually need to be ambulatory. They need to be able, again, to feed themselves. Although there's some care homes that may have those services available. Toileting and bathing should be done with minimal assistance. Because remember, some of them, again, might not have that ratio. That is what you need if your loved one needs more care than that. So here's the link. This is licensed care homes linked to the State of Hawaii Department of Health, Office of Healthcare Assurance. It's a really long name, but it's a very, very well visited site, I'm thinking, because when people start looking at where to put their family member, and we get these calls all the time from our family members, I think I want to put my mom in a care home. Do you have any idea of a good care home? Well, this list, if you open it up, I printed it out yesterday morning, and it was updated in January. It's 10 pages long. These are just the licensed care homes in the state. So it includes all islands, but I counted about 450 care homes that are licensed in the state. It's also really small print, so you have to get your reading glasses out to read this. Even online, it's really small. So, but it has a lot of information. It does give you a place to start because it's listed by location. So if you want your loved one close to you, you want to kind of look in that area that is near you. The other thing I can mention is that aside from the licensed care homes in the state, there are probably thousands of unlicensed care homes. So these are care homes that you can just call up and say, hey, I need my mom to stay in a care home. If they're not licensed, they could charge you whatever they want. They don't have to follow the standards that are put forth by Department of Health, Office of Healthcare Assurance. So this is basically the quality center for the Department of Health, making sure that people follow the regulations and rules for licensed facilities. There's a lot of care homes, and I'm sure they're really busy trying to make sure everybody's doing what they're supposed to be doing if they're licensed. But as a nurse working in this community, I can say that a licensed care home is your best bet for safe care. Doesn't mean that the unlicensed care homes aren't safe. It just means this guarantees that the licensed ones are a better choice to start with. Okay, so you can check that out. Okay, the next thing we're going to talk about are assisted living facilities. Sometimes these are called ALFs, A-L-F. I hear that a lot, and I'm like, what is that? But it's assisted living facility. So there's a lot of these popping up around the island, and some of them are built in conjunction with an independent living facility, or a skilled nursing facility might be in that building, as well as maybe a memory care unit. So these facilities are having to expand their level of services because people move in and out of these services and levels of care as they get older and as things change with them. So the advantage of an assisted living facility is you get to live independently. in a safe environment. Again, independently in a safe environment. Meals are provided. You go down to the dining room. As long as you can get there, you have to be able to get there. You can use a walker, a cane. Sometimes you can use your spouse, but you do have to be able to get there. Healthcare is usually monitoring depending on the type of floor you're on. It's available if you need it. You can also get help with your activities of daily living, which is your ADLs. They do offer housekeeping and they can do your laundry. So these are the things that make you more independent. So you can work on aging and enjoying your life as you age with your spouse. There's also, I'm sure, lots of activities in an assisted living facility. So the requirements for getting into an assisted living facility is that you need to have some assistance with your ADLs. So I'll go over what ADLs are, but basically they're bathing, dressing, eating, transferring, and I think there's one more, but I'll get to that. If you need assistance with any of those, an assisted living facility is probably the right place. It's not appropriate for those people who are severely cognitively impaired, those with advanced Alzheimer's or dementia. They need to be able to find the way around or be able to care for themselves part of the time that they're in their residence. It's not appropriate for those that have behavioral symptoms, those that aren't able to manage because of their cognition, or maybe they have what we call sundowning behaviors. Certainly some of that can be managed in an assisted living facility, but that needs to be evaluated. So if you're interested in having your loved one go to an assisted living facility, someone's going to come and see them. They're going to evaluate them. And one of the things they're going to look at is their level of care. And these are usually not covered by Medicare. There may be some help if you have long-term care insurance. This is something that a lot of us don't have, or we didn't think about getting when we were younger. But if you can still do it, I would highly recommend looking into it because it does help with the expense of some of these places. So the next one, we're kind of backtracking a little bit, is an independent living community. An independent living community is just what it sounds like. You're independent. You don't really have any services available to you. But like I said, some of the facilities on the island are opening up units or floors that are independent living. And that way, if let's say that you live in an independent unit in a facility and you don't really need anything now, but something happens down the road, you have a fall or you get sick and end up in the hospital, these facilities may be able to accommodate you and put you on their skilled nursing floor for a week or two before you move back to your independent residence. Maybe you need to go to an assisted living unit in the same facility. So what's great about these communities is they can help with those transitions. Again, independent communities usually are for those 55 and older. They have enrichment activities, they have outings, they help you with your residence maintenance, trash pickup. You can get optional services for meals, housekeeping, transportation. You really have to check out the facility. So basically, to live independently on a unit that's independent in a facility like this, you have to be able to do all of your activities of daily living on your own. And you probably need to clean up your place too on your own. So one other part that may be part of these facilities is what I talked about earlier, is a memory care program. These are really great because if you can still walk and your loved one is still ambulatory, they just need supervision and cueing, reminders to take their medication, to take showers, but yet they don't remember or they can't cognitively figure out that it's time to eat. These memory care programs can help with directing, servicing. They can also provide activities that they're able to understand. It does allow them to interact with other people on the unit that might have issues the same as theirs. It allows for maintenance of the residents to be done by the facility, because if you're having memory issues, you're not going to remember to clean up, do your laundry. Those kinds of services are all part of the memory care program. The important part of a memory care program is that it's a locked unit. So I've seen this where we have, our 88-year-old lady who lives on the memory unit, and she always tries to get out. So sometimes the facilities are challenged with these kinds of people because they don't know why they're there. They think they need to go home. So a lot of them see that door opening, and if you're not fast enough, they will try to get out. So that takes some special skills. The staff needs to be trained in order to deal with redirecting, with encouraging proper behaviors. It's a challenge, and there are some actual care homes too that I think are specific to memory care, but some of the facilities do have units in their building that is specific for memory care. So what do you need to be on a memory care unit? Well, you obviously have to show some decline in your memory or your cognitive abilities. And you have to show that you're not really safe being left alone, that you're starting to do things at home, maybe that if you had just remembered that the pot was on the stove when you turned it on instead of going to take a nap, you would have been safe, right? So sometimes these lapses in cognition and memory are an indicator that they need to be in a memory program. We see a lot of this in home care because of families are sort of at their wits' end and aren't able to manage somebody who is not able to remember. Okay, our skilled nursing facility. So what is the difference between, say, an assisted living facility and a skilled nursing facility? Well, it has the word nursing in it. So what that means is that something is going on with your loved one's condition that they need to have a nurse provide, or some professional provide care or therapy or monitoring because of whatever condition your loved one might have. So an example would be people that go into a skilled nursing facility need to be there for maybe a rehab situation. Maybe something has occurred where they had fallen, maybe a hip got broken, they were in the hospital for weeks. So the discharge planner comes to you as the family member or as the patient and says, well, we need to send you to a rehab. So a rehab is one form of a skilled nursing facility that provides therapy for you to get stronger, to get that hip better, to get you back to what we call baseline activity. If you can do that, good job. If you can't, you might have to stay at the skilled nursing facility for a little longer until you get those abilities and that ability to walk around like you had before you ended up in the hospital. So the good thing about skilled nursing facilities is they can treat, they can manage the condition, they can observe you for improvement, and then they can evaluate whether what they're doing is good and is working. Medicare will usually pay for some of these costs, and there might be a copay to these. So what is the requirement to get into a skilled nursing facility? Well, you have to have a treatment need that can only be done by a licensed nurse. If it's something that can be done at home, then they probably will try to send you home. If it's something that can be done in an assisted living facility, you might have to pay extra to have a nurse come in and do it, or a PT. Sometimes we get skilled nursing care in our home. This is a nurse that comes that is covered by Medicare, and she may initiate a PT, OT, or speech therapist to come to the home a couple of times a week to get you again back to baseline. But if they think you need more monitoring because your support system at home might not be able to do that, they'll recommend a skilled nursing facility. So there's a lot to consider, and it always is going to depend on your own individual situation. So the last thing that you might want to consider is in-home care, what we call aging in place. And I know that as a nurse who's worked with a lot of families who have gone this way, I hear a lot of stories, and we try to work with individual families to make sure that their story fits into a home care situation. So I know a lot of families that over the years have said, well, I told my mother I would never put her in a nursing home. A nursing home. If you notice, none of those titles that I put up on the screen said nursing home. They're facilities. They're different than they were 40, 50 years ago. I know that when I was younger, I had my grandfather had a stroke, and he was put in a nursing home. He was unable to walk, unable to talk, but yet he was still in there. So at that time, that was probably the appropriate place for him. But I remember going to that nursing home as a child and seeing him suffering, not able to talk, not able to engage, yet he was still there. So it was always very sad for us to go. And I think that this generation that may be getting older now, maybe in their 70s, 80s, 90s, may have that image of a nursing home when we talk about nursing facilities or assisted living facilities. It's totally different now, but still families have promised, I will never put my mother in a nursing home. So what we try to help them with is getting them through the transitions that they might be going through by having care in the home. So there are basically, in general, two types of home care agencies. There's a home health care agency, and again, that word health is in the title. So it means that there's some sort of health care needed or skilled nursing care needed by that loved one who's in the home. So this could be your home care nurse who is covered under your Medicare benefit. The doctor could order PT or OT or speech, and that has to be managed by a nurse who observes to make sure that those therapies are done in the home. This doesn't last very long. It could be a 2-week, a 4-week sort of stint of care. It also doesn't do the daily care. It's just they're there only for like an hour to do that PT or OT. There are also private duty agencies that are home health care agencies that have skilled nursing available and are able to do skilled nursing, but they also are able to do more advanced care needs and work with payer sources like certain insurance companies. There's other payer sources that could possibly pay for these services. One example is the Veterans Administration has a homemaker service that allows veterans who are service connected, which means they've actually served during a wartime, and they've aged into a need where they need care in the home. The VA usually can provide anywhere up to 10 to 15 hours a week, depending on your needs, and that can be serviced by a home health care agency. Other insurers do cover this, but usually they're a Medicaid connected insurer like United Healthcare, HMSA, Ohana, Kaiser, and Aloha all provide Medicaid services for in-home, what they call personal assistance care, and that has to be done by a home health care agency. So the difference between a home health care agency and a home care agency, both nowadays need to be licensed by the state, and I'll get into that later. But what a home care agency does, and there's a lot of these sort of popping up around the island, they just provide non-medical care, such as supervision, help with housekeeping, meal prep, assistance with personal care, but maybe not doing too much advanced care needs like Hoyer lifts or G-tube feedings. They all can be done in the home. That kind of care needs to be done by a home health care agency that has more advanced care and licensed nurses that can supervise that kind of care. Both agencies require an assessment. Usually they'll come into the home, look at your family member, and do, again, what we call a level of care assessment. That will determine sort of maybe what you're going to pay as a rate. Usually home health agencies have different levels of care. Our agency has what we call a health companion or a supervisory kind of care that is just for those that need queuing, supervision for safety, meal prep, housekeeping, and then we go up all the way up to skilled nursing in the home. But our one level of care that a lot of people don't know about is this advanced home health aid level that allows us to do more advanced care in the home. And a lot of families are taking advantage of that, because when you move into a situation where your loved one needs more care and you still want to keep them at home, you have the opportunity to use that same agency if they do that kind of care, because they already know your family member, rather than switching up just to a different type of agency. So it's something to think about. Definitely home care is always going to be preferred by your loved one. If they've lived in that home for a long time, they certainly will want to stay there. They'll want to stay till the day they die. But things change. So there are lots of options out there. So if we're going to use a home health care agency, there are some reasons to use a home health care agency. I did talk about some of this already. If the agency sends a caregiver in to do the care for your loved one, and that caregiver calls off sick, we can always send in a replacement, and we'll be able to orient and educate that caregiver on the care because we're familiar with it already. The agency will do all of the aspects of employing your caregivers, things like training and hiring process. All of that can be done by the agency. You just need to employ the agency to be able to put a caregiver in the home. There's also agencies that have supervision of their employees and agencies that don't have supervision. So if you ask questions about how is the caregiver supervised, you'll be able to get some good answers that might sell you on that kind of care, because without supervision, the caregivers may or may not have people to answer to if care changes. And it means you would have to be more involved. Also, the caregivers tend to get really close to your family too. So that sometimes is a good thing, sometimes not such a good thing. You'll have multiple caregivers if you use a home health agency, because that's sort of how a lot of our agencies work. Having one caregiver, I know that experience working with families who just have one caregiver 5 days a week is kind of risky, because now you're counting on one person to know the care and be there every day. And if that person decides to take a vacation or decides to quit the agency, you're going to have to start all over with orienting and training a new person again on the care of your loved one. So we always recommend multiple caregivers, just so that you have a backup person in case one of them is sick or out or on vacation or leaves the company. It's just a better way to go. I've seen it happen both ways, and it always works better with multiple people in the home. Sometimes you may not want that because your loved one may have issues with remembering people and may want to have the comfort of having that same face every day. So talk to your agency about that and see what kinds of things they can offer you. Okay, so to prepare for in-home care, there are some questions that you're going to be asked. So just so you're aware, if it's a good home health care company, they're going to ask questions to prepare the agency to provide the best quality care they can. So they're going to want to know things like, and actually anybody, any facility, any additional care venue that you're going to choose are going to ask these questions. So even if it's a skilled nursing facility or an assisted living facility, they're going to want to know some history about what your family member's level of care is. So they're going to want to know what kind of health care they have. Is there a doctor involved? I can't tell you how many times I've had families say, oh, my mom hasn't been to a doctor in months or years even. And I'm like, okay, well, we need to get them to a doctor so we can understand their condition. We usually recommend a geriatrician for our elderly loved ones. They tend to have a better handle and a better way to look at aging and people who are in that situation. They tend to have a different direction when we go to interventions. So they're going to ask, what kind of personal care does your loved one need? Can they go to the bathroom by themselves? Are they able to dress themselves? Can they make a meal? Or can they take a shower on their own? Or do they need help with that? What is their mobility like? They use a walker, cane? Are they dependent on a wheelchair? If they don't have a wheelchair, can they stand? Also, what we do in the home is we look at what is the chair they're usually sitting in. There's a lot of homes that have those old sofas that are really low. So that's an indication that maybe getting out of a chair might be easier if the chair was higher. So these are the kinds of things that having other people ask these questions can help you either change what you're doing or improve how you're doing it in the home. Transfers, I talked about this. This is how does the person get from a sitting position to another sitting position or to a standing position? Do they actually need someone to lift them up? Can they do it on their own? These are the things that PTs and OTs work on with people who are losing their strength to get them to stand by themselves, become more independent, versus having somebody have a hand out to help them stand. What are their transportation needs? Do they need to get to the doctor? Who does their grocery shopping and who gets the supplies for the home? Is that a family member? Is that going to be put on the agency to do? Financial needs. This is something that as a home health agency, we don't allow our agency personnel to get involved in people's finances for liability reasons. So there needs to be a way to have financial matters managed. And also that person might want to go shopping. So how does that person maintain their financial control? Then we talk about cognition, hearing, eyesight, behavior. All of this is important in determining level of care. What kind of equipment do you have, or does your loved one need? Is there grab bars in the showers? Is there a shower chair? Do they need a hospital bed? If they don't have a hospital bed, would that make it easier for them to be more independent? I know that having a hospital bed in the home makes people think, oh my gosh, I'm really getting old, I need a hospital bed. But that's not necessarily the best way to think, because actually hospital beds help people become more independent in their mobility getting in and out of bed. So you can imagine if you're in a flat bed that maybe is a king size bed that you've slept in for the past 20 years, you have to now get out of that bed after being in a hospital, and now you're home and you're weak and you can't get out because you're not able to sit up on your own. If you had a hospital bed that has a rail, you can actually learn how to sit up by yourself and get out of that bed on your own, which gives you more independence. Some people don't understand this. And so when we recommend hospital beds, they usually go, oh, no, I don't want a hospital bed. But it's not such a bad idea for some people. The one thing that is interesting about doing care in the home is we have multi-generational homes now. So there's lots of family members living in that home. So always before we go in, we always ask, is everybody in the home okay with the caregiver coming into the home? It could be that, mom needs help, but dad, we didn't tell dad that we were going to have somebody come in and help with mom, because maybe the daughter is calling from Maui, and she knows that her dad wouldn't really want a caregiver in the home because dad's been caring for mom all these years. So when we show up and the dad answers the door and he's like, "What are you doing here?" So one of the questions we always ask is everybody on board with this decision? Just as if everybody should be on board with any decision that involves your loved one, including your loved one. So it's usually a family decision, and having a family meeting with your loved one, moving into the next decision on where they should be or how they should be cared for should be agreed upon by all involved. And also, if you're going to use a home health agency, ask to see their license. They should have a state license. If they're providing care in the home, it's required. And if they have an accreditation. This means that they're meeting higher levels of standards for in-home care. Okay. So now we get to the part that actually helps you to understand what levels of care in a community really are. So again, this is really general, but looking at these activities of daily living is what we call functional ability. So whether you know it or not, if you have somebody come into your home or somebody come and talk to your loved one and discuss some of these things, they're actually deciding or helping to decide what level of care they're at by asking these questions. Activities of daily living are listed here: bathing, dressing, toileting, transferring, bowel and bladder, continence or incontinence, and ability to feed themselves. So you can either have assistance with these activities of daily living, or you could be independent in these activities of daily living, or you could be completely dependent on these activities of daily living. In other words, if you're completely dependent, you can't do any of these things without help, or even at all. You can't even, you need somebody to do all of these things for you. That's a dependent functional ability. If you just need a little bit of assistance on some of these, like maybe you can't get in and out of the bath by yourself and need somebody to stand by or wash your back, that's assistance with these activities of daily living. Maybe you can't cook a full meal or feed yourself, but you can, if somebody were there to help you, you would be able to do it. So those are activities of daily living, what we call ADLs. So somebody might be asking these questions if they're trying to determine level of care. So there's another set of questions that they might be asking, and it's categorized as independent activities of daily living. It's a different set of activities. These questions also helps determine what kind of help you're going to need. So in other words, can your loved one use the telephone? Maybe they can, maybe they can't. Maybe they can pick it up, but they don't really know what to say. Maybe it can be a good or a bad thing, because especially with the telephone scammers out there, it may not be a good thing that they can use the phone. So it's a good question to know the answer to. Does your loved one have the ability to walk distances? Can they get from their bedroom to the bathroom safely? Can they get to the kitchen safely from the bedroom? Can they walk outside around the house and go to their garden safely? Can they get their own groceries? Can they go grocery shopping by themselves? Are they able to prepare their own meals? Can they make a sandwich, or can they make a full meal? How much can they actually do without assistance? Housework is in there. Can they manage their own housework? Do the dishes on their own? So these are things that you need to start observing. Maintaining their home. I'll tell you a story. You know those big trash bins that we all have in our yards now that we have to take down to the curb, right? So that's part of home maintenance. You take your trash bin to the curb. Well, how much do you know whether or not your loved one can do this? If they're living alone and nobody's doing it for them, can they do it safely? We had a elderly couple come to us because the daughters wanted us to go in and help with their care in the home. And this elderly couple, living alone for many, many years in their home of many years, didn't want the care. They only wanted a few days. So one thing that happened is, because they wouldn't let us come in every day, they had to take the trash bin down to the end of the driveway one day. And because both of them had gotten quite frail, they both decided that they needed both of them to do this task. So if you can imagine two elderly people trying to take a trash bin down to the end of the driveway, and unfortunately this driveway was kind of steep, and I'm sure you can guess what happened, but they both ended up on the ground. And I don't think the trash bin actually made it to the end of the driveway, but they both were injured. Fortunately, a neighbor called, and an ambulance came and took both of them to the hospital. So these are the kinds of things that we have to ask ourselves: can our loved one do this by themselves? Do they need help? Ability to do their own laundry. Maybe that's something they're not able to do anymore. And of course, taking medications is always a concern if they're not doing it properly. I've been in a home where this woman lived alone. She managed her own medications. She had some cognitive impairment, but she was physically capable to do anything she wanted. She could walk, she could get anywhere, she could even take her own showers, but managing her medications was not something she was capable of doing. She actually had all of her medications on a shelf unit, and she had them all out of the bottles in different containers. It sort of looked like an M&M factory where there were different colored pills everywhere. And that's how she wanted it to be. She thought she knew what she was doing. So of course there needed to be more intervention by the family after that visit. But this is the kinds of things that we see happening. And if we don't notice that they're happening, then things start to go downhill pretty quickly. And again, I mentioned finances. If they are unable to manage their finances, you're at risk. You're leaving them open for financial abuse. You're leaving them open to give their money away and spend their money as though they had an endless pit of money. And now if anybody's getting online and purchasing things, I've seen that happen too. They don't have control over the amount of money that they are spending, and then finances dwindle very quickly. So there's one last thing that you will be asked about, your loved one will be asked to participate in, and it's usually a way to evaluate their cognition or their mental status, their ability to use their brain. These are screening tools. These are not diagnostic tools that tell you that they have dementia. It just means that they are using these tools to kind of indicate where they measure at this point in time. And then in 6 months, when they come back to the doctor's office, they may do this again and see what their scores are and how different they are over time. So the one is called an MMSE. It's the Mini Mental Status Exam. This, you may not know your doctor's doing it, but they will ask questions. It's usually very quick and easy. They don't need equipment for this. They just sort of ask questions, you know, like, do you know what day it is today? Do you know what year it is? Do you know what city you're in? So these questions might sound familiar, but really what your doctor's doing is evaluating your cognition. Usually they tell you up front that they're going to ask you some questions, but if they don't, then you find that they're asking these questions. That's why they're asking. It gives them insight into your ability to use your memory and your brain. So the other one that they might do is this thing called a mini cog test. It actually stands for mini cognitive test. And again, it's a screening tool. It takes 3 minutes to do it. It can consist of 3 different steps. You're asked to remember 3 words in the beginning, and then the next step is to have you draw a clock on a piece of paper and give them a specific time to have the hands of that clock read on that clock face. And then after the clock drawing is done, then you go back and you ask them, okay, what were those 3 words that I just gave you? So it's a screening tool. It's a way to help determine cognitive ability. So for a minute, I just want to talk a little about what level of care can mean for you when you're looking at how to determine where your family member should be. One of the things that I've learned a lot about doing this kind of care is long-term care insurance is now looking at cognitive impairment as a qualifier, possibly, for reimbursement for long-term care. We've had a lot of different insurers call us and ask about cognitive ability, ask about level of care. They go through that list of things, those ADLs that I talked about, to see where that person is. That actually determines whether or not they're going to reimburse you. So you need to read your long-term care insurance policy very closely. Okay, so this is getting close to my last slide. This is a set of questions that are really asked. I really would like you to ask yourself. So I know you may have some questions, but I want to ask you some questions first that will help you determine what direction to go in with your loved one's care. So the first one is, does your loved one need 24-hour care? How do you know they need 24-hour care? What are you seeing that's happening? Sometimes we'll have our loved one in the hospital and the discharge planner will come up to you and they'll say, oh, your dad needs 24-hour care. There's no way you can send him home. We can send him home without 24-hour care. And you're like, what does that mean? So it means that between the family members involved in caring for your dad and maybe another caregiver that you may want to hire or a home care agency that might come in and help with this, he needs to have supervision 24 hours a day, 7 days a week. If you're paying for this, it can be quite expensive. But if you have family members that can help with this, you can still provide 24-hour care and supplement with a caregiver to give your family a break. So that's a question you need to ask yourself. Does my family member need this? The only way to really find out is have somebody do this level of care evaluation. And that's what the discharge planners are supposed to be doing in the hospitals and other facilities. Is this going to be for the rest of their life? Or is this just a temporary stint of 24-hour care? So maybe they just had a setback. Maybe they became weaker for whatever reason because they weren't eating correctly or they had a fall. Maybe the 24-hour care is only going to be needed for a week or two until they get back to, again, what we call baseline. Where were they before the event happened or before the diagnosis happened? Is caring for your loved one affecting the health of a family caregiver to the point that the family caregiver's health is starting to fail? So we see this a lot. We try our best to take care of our family members who need care, but after years and years of caring for somebody, it does take its toll on the caregiver. So if that's happening, you need to change what you're doing. Are dementia behaviors becoming too difficult to handle, or is your loved one not safe in the home due to wandering risks? So these are indicators that, oh my gosh, this is, I need to do something different. Don't just let it continue to get worse and worse. That person could walk out of the home and you may never see them again. Wandering is a very dangerous thing to deal with if you don't pay attention and do something about it quickly. Does your loved one still engage in family activities and social situations, or are they isolating themselves? So this brings up a good point that our aged community, our kapuna, are not getting diagnosed with depression as much as they probably should be. So it's definitely something that we should look at as a community of healthcare providers. Isolating is a sign that they just don't have it in them to continue on with engaging in life. Do something different in this case. Get them into a geriatric psychologist, someone that can evaluate their need for antidepressants, or change what they're doing. Send them to adult daycare. Maybe that would be enough to help them get out of the isolation mode. Is your loved one still eating enough or the right kinds of foods to maintain their health? So you're going to know this as time goes on. If they're not eating well, their health is going to start failing. Their clothes are going to start looking like they're hanging on them. They're not going to be as strong or able to get in and out of a chair as easily as they used to. So look at what they're eating. Check the refrigerator. Do their shopping for them if they're not getting enough food, but check to make sure they're actually eating the food. If your parents are still together, is one of them doing more care for the other, and it may be affecting their health now? So then you end up with two people who might need care. So if that's the case, get help for the spouse, get help for your father to care for your mom, get help for your mother to care for your dad. Don't just let it go on, because things can change rather quickly. Does your loved one have safety issues when left alone? Again, I mentioned this. Are they leaving things where they shouldn't be leaving them that are causing them to be in a dangerous situation? The pot on the stove that's boiled now down to nothing and is now burning up is an indicator that they are not safe to be left alone. Falls that happened when you're not there, not safe to be left alone. Not taking their medications, not eating, they're not safe to be left alone. So these are all, they happen gradually. This is not something that's going to happen overnight. You're going to start noticing things. Pay attention is really the message here. Are there problems with medications not being taken? This is an issue, again, that if they're not taking their medication, such as their blood pressure pills, you're setting them up to have a heart attack or a stroke. That's going to cause more problems. They're going to need more care after that. So the medications should be evaluated by their physicians annually. Everybody who's on the care team should know what medications are being taken, and they should also know what the side effects of those medications are. And lastly, are the bills not getting paid? Are the envelopes rising, building up on the kitchen table? Are they not getting opened? Is the electricity gone off because they didn't pay the bill? So these are clues. Change the direction of your care expectations for your family member. My last slide. So this is an interesting way to think about care in the community. I put it on what we call a care continuum. That kind of shows you what could happen at any time during the time in the community that your loved one who's aging might have to go through. So we start out normally with normal aging, which, normal aging is you can still do everything on your own. You might be taking a few medications, but nothing really major is happening that's keeping you from doing what you want to do. Then maybe a diagnosis comes up. Maybe you get diagnosed with COPD or diabetes or kidney disease. Very common in Hawaii for people to have kidney disease, and they don't even know they have it. So they're walking around with it, and then all of a sudden you get hit with, oh, your kidneys are failing. So that's change in their condition. Maybe the change in condition leads them to have to now need dialysis or some other therapies that involve time, monitoring, more doctor's appointments. Maybe the condition that they have leads them to a hospitalization where they can get back to baseline if they go to a rehab or a skilled nursing facility for a little while. So maybe they get back to baseline and now they can benefit from some daycare or some adult daycare or adult day health care. Or maybe some home care could come in and help with some PT. So you can see that people can move in and out of these boxes, but eventually are going to get to the point where they are closer to the end of life. And we're all going to get there. There's no stopping it. It's just how you manage these hiccups, these transitions from one level of care to another. So you could end up in an assisted living facility for a while. Maybe you want to get back home at the end of your life. A lot of people want to have their end of life, their hospice situation in home, or they can also do it in facilities now. Facilities have hospice beds. Anyway, it's a continuum of care that changes as we age. Levels of care are going to go up and down as we age, depending on what we're facing. And how you age, basically, it depends. But from me to you, I'd like to wish that you age well and that your health stays as good as you can possibly make it. At this point, I guess we can go to questions and see if anybody has any questions or comments for me. The last slide, I'll just real quickly go over the resources that are in the that are out there for you and sort of show you a little bit about where I got some of my information aside from what I've been through. There's a really great book that comes out every once in a while. Every few years they update this book. I don't know if you can see it. It's the Senior Information Assistance and Handbook, and there's a lot of really good information in here, a lot of really good resources for places to have your loved one go to, help that you might need. There's a number on the back here that I'm sure if you call, you can find out where you can get this book. They're pretty good, and they've made it bigger print, so we can read them better now. There's also some other really good family caregiving resources. I'm just going to show this one that I used and I was able to download actually from the Elderly Affairs Division. City and County of Honolulu actually has this wonderful document that they put together for caregivers to use as a resource. It's a family caregiving guide. And some of what I went over in this webinar is in this caregiving guide. Obviously, you can see it's quite thick, so there's a lot of information in there, but that might be a good place to go if you go to that website. Medicare.gov also has some good resources to use if you're looking at a skilled nursing facility. There's actually a nursing home checklist that you can go through if you're going to a skilled nursing home, a nursing facility. You can ask questions about the facility and get some good answers so that you have a good handle on what the facility is like. Anyway, that's it. I'm ready for questions. If there's anything that anybody has they want to know more about, I'll try to answer it. Don't know that I have all the answers, but if I don't, I can probably look that up and see if I can help.
Well, right now, looks like we do not have any questions other than an inquiry regarding the webinar. It says, how are we going to get certification that we attended this webinar? And if you send me an email at hpgsmembers@gmail.com, I can send you a certificate of attendance. Thank you for sending in your thank yous. We have one comment that says, thank you for the information. It was very good. Eileen, do you want to give out your contact information in case people have more questions later on?
Sure. I work for a home health agency. The name of the company is Attention Plus Care. We've been in business now for 35 years on the island of Oahu. I can give you our number. It is 739-2811. We do offer home care workshops that I failed to mention, but it is actually quite helpful if you would like to come in, sit with us, and discuss your specific situation. We can give you all sorts of education about how to find the right kind of care for your loved one based on our experiences that we've had with other families. We enjoy what we do. I've been in this company for 20 years and have enjoyed every minute of it, working with families who have elderly and loved ones who need care in the home. So 739-2811. I'm here usually every day, Monday through Friday. I'd be happy to talk to you if you have some questions about home care. Okay.
All right. And we have another comment. Thank you very much for the excellent information and presentation. And another attendee is asking if we can list where we can get the book and the booklet that Eileen previously showed. The phone number was not clear on the screen.
Okay, let me show that again. We can also announce the phone number, which might be easier, but I'll bring this a little closer. Can you read that, Mapu?
Yes, 768-7700. That is the senior helpline, I believe, with the Elderly Affairs Division. So if you give them a phone call, they can help you out with, I'm sure, anything senior related.
Yes.
And direct you to other resources as well. The phone number for Attention Plus, again?
739-2811.
Do you have a website?
We do. It is www.attentionplus.com. And this is, again, what the book looks like. It's really pretty this year. So a lot of good information in there. Or you can sign up to come to one of our workshops, and we'll talk to you specifically about your situation.
All right. A lot of more people saying thank you for your presentation. Eileen, thank you so much for being here today and talking to us about the levels of care in our community. And we look forward to seeing you possibly again on one of our webinars.
I've enjoyed it. Thank you so much for watching and sharing this with me. Thanks, Mapu.
Oh, I'm big. So before we go, I wanted to recap and talk a little bit about today's webinar. So if you do need a certificate of attendance, please send me an email at hpgsmembers@gmail.com, and I can send you a certificate of attendance via email. Other than that, we had this last week, April 18th, our general membership meeting, where we had Dr. Poki'i Balaz, Jody Mashan, and Cindy Osajima talk about dementia, tips, tricks, and resources. So a lot of our resources that they've shared with us will be shared with our membership through our May newsletter. So if you are not a member yet, please do sign up. Visit us at hpgs.org for more information, or you can always send me an email. Other than that, next month on, let's see, I think I have a slide on that.
May 30th.
May 30th will be our next webinar featuring Dr. Warren Wong. He created an app called MemorC, which could be found on the App Store. I just downloaded it yesterday. And what it does is it helps connect people with memory problems, connect them to the people that love them. So you upload a picture of them, you input a little bit about themselves, their name, maybe a few of their preferences, and then there's these little games that they can play so that you can also play along with them and help connect them to their memories. So we'll have Dr. Wong talk about that next month. Same time, 11:30 till 12:45, and this flyer will be sent out May 1st, and then every week after that until the show date. So please do sign up for that one. If you want to sign up now, you can send me an email to hpgsmembers@gmail.com, and I will send you the RSVP link personally. And you can also spread that out to your friends and families, coworkers, whoever's interested in learning more about this inventive way to connect with people who are living with dementia. Other than that, thank you all for tuning in this month with Eileen Phillips talking about levels of care in our community. And if you do have more questions, please reach out to her at, what is your number one more time? Sorry.
739-2811.
739-2811. Give Eileen a phone call and she will help you with whatever you need, personal or professional. Other than that, thank you so much for tuning in, and we'll see you next month.